I think the passion and vision for this cancer center actually came from the community itself.
The generosity in this community is, bar none, extraordinary.
I would define the Barshinger Cancer Institute as not only a great architectural structure for the treatment of cancer patients, but also a place in your own backyard, your own home, with family around, for you to receive world-class, cutting-edge cancer treatment.
The patient should be the focus of any medical program, and we want to make sure that patients have access to big city care close to home.
Going an hour and a half, 2 hours away, and then having problems, not being able to contact anyone, not being able to be seen, it's just not ideal.
If you put together the number of hours that any cancer patient spends in treatment, to have to travel for that is a huge burden.
We are committed to a team-based approach for cancer care that ultimately gives patients and their families the greatest convenience.
We provide top-notch surgeons, top-notch medical oncologists, radiation oncologists, but it goes beyond that. We have the nurse navigators, we have the dietitians, we have the counselors, social workers.
The holistic care is a huge part of cancer care now. So we have pastoral services, we have social work services.
It's very comprehensive in terms of technology. We're state-of-the-art. We're providing technology that most academic centers don't have access to. And so we are really a regional cancer center providing a high level of care and a very comprehensive level of care to our patients. And we have that academic tie to the University of Pennsylvania as well.
I'm excited about the partnership with the University of Pennsylvania because it gives us a closer working relationship with an academic center.
There are research opportunities, access to clinical trials, access to second opinions.
It's research, it's a better understanding of the differences between patients.
We now know more about the genetics and molecular changes associated with cancer, those changes that make cancer cells different from normal cells, and that gives us new opportunities for research, and it gives us new opportunities for care.
From a surgical standpoint, we've really seen breast cancer treatments evolve. From the days when women underwent a lumpectomy not knowing whether they'd wake up with their breast intact or not, to breast conservation.
We're going to be the first in the United States to have the M6 CyberKnife unit. It's the most sophisticated radiation tool out there today to deliver high doses of radiation to give better chances of cure, but also minimize toxicity, and also it's much more convenient to patients, much more shorter treatment times, less side effects, better cure rates. That combination is a wonderful thing for our community.
I think the future of cancer care is more prevention, more involvement of our patients in their own care, more team-based care, more use of evidence-based medicine, more personalized medicine.
Things are getting easier for cancer patients. We have a number of new treatments that are helping people live longer. We have a new focus on having people live better while they're living longer.
You know, there's really nothing quite like seeing somebody go through this diagnosis that none of us want to hear, and find inside of themselves the power to undergo the therapies and to come out on the other end healthy and engaged in life, and that's the greatest reward of all.